Hello, welcome to my presentation. My student ID is U3263170. Today I'm going to provide a presentation on the drug named Peramivir. Hope you enjoy my presentation. Peramivir. Peramivir is an antiviral medication primarily used to treat influenza. Pharmacokinetics of peramivir. Intravenous peramivir shows a linear dose-proportional pharmacokinetics with a central volume of distribution of 12.56 liter at doses ranging from 0.17 to twice the recommended 600 mg. With less than 30% binding to plasma proteins, peramivir reaches peak levels in pharyngeal and bronchial fluid that exceed the IC50 for influenza after a 600 mg dose. It is largely cleared unchanged by the kidneys, accounting for 90% of its elimination. With a half-life of 20 hours, the risk for drug interactions is low, and live attenuated influenza vaccines should be administered at least 48 hours after peramivir to prevent reduced efficacy. Pharmacokinetics remain consistent across gender, age, and ethnicity, and they are similar in pediatric patients aged 2 to 17 years. However, dose adjustments are crucial for individuals with severe renal impairment who may have significantly increased exposure. In these cases, dosing should also occur post-dialysis, as starting dialysis soon after can greatly lower systemic exposure. Local prescribing information should be referenced for specific considerations. Mechanism of peramivir. The influenza virus is a segmented RNA virus that infects mammals and birds using two glycoproteins, hemagglutinin HA and neuraminidase NA. HA helps the virus attach to host cells, while NA enables the release of new virions by cutting sialic acid from host cell proteins. Peramivir is a potent neuraminidase inhibitor (NAI) that binds to the active site of the NA enzyme. By competing with sialic acid, it prevents the virus from being released and spreading within the respiratory system. Although its chemical structure is similar to other NAIs like oseltamivir and zanamivir, peramivir has a stronger binding affinity to Na. Studies suggest that using peramivir alongside oseltamivir doesn't reduce their effectiveness, with no notable antagonistic interactions observed. This indicates the possibility of using both medications together in influenza treatment, potentially increasing antiviral effectiveness without negative interactions. Psychological effect. Intended effects: reduction in symptoms and durations, decreased viral load causing quicker recovery. Number two, adverse effects. Clinicians should be aware of potential adverse effects. Confusion and hallucinations can occur, particularly in pediatric patients, indicating possible neuropsychiatric risk. Additionally, leukopenia may lead to increased infection risks. Concurrent neutropenia exacerbates this concern. Some patients may also experience hyperglycemia and hypertension, placing careful monitoring. Gastrointestinal upset, including nausea and diarrhea, is commonly reported and can affect patient comfort and adherence to treatment. SUSMP schedule. Peramivir is classified as a Schedule 4 substance, indicating it is a prescription-only medication. This classification restricts its use to qualified prescribers, including medical practitioners, nurse practitioners, authorized specialists, and physician assistants working under a supervising physician. Dispensing of peramivir is limited to licensed pharmacists who ensure proper patient counseling and safety, and pharmacy technicians under the supervision of pharmacists. Clinical considerations. When using peramivir, assessing renal function is crucial, particularly for pediatric patients and individuals with renal impairment, as dose adjustments may be necessary to prevent toxicity. A thorough history of psychiatric disorders should also be considered due to potential for neuropsychiatric side effects. Informed consent is essential. Patients may be fully educated about the treatment benefits and risks before administration. Additionally, follow-up care is important to monitor for any adverse effects and ensure the patient's recovery process is on track. Legal considerations. Ensure that the drug is legally prescribed and dispensed while closely monitoring for adverse effects. Ethical considerations. Obtaining informed consent from patients and providing thorough patient education regarding their treatment options, including family members in discussions to support the patient's decision-making process. Furthermore, collaboration with healthcare team fosters a comprehensive approach, ensuring that all aspects of patient care are addressed and optimized. Let's check the knowledge which I provided in the presentation. These are the two multiple choice questions. Please feel free to attend. And lastly, these are the references that I used in my presentation. Thank you for your time.